The National Health Insurance Act is a reality waiting for implementation. Authorities say it's an attempt to level the playing fields.
There is no debate at all that South Africa is the most unequal society in the world. And if you want to see that inequality or what inequality looks like, you come to the health sector. Within the borders of the same country, some are getting world-class health care, while others get such a poor health care, we may believe we live in different countries. We can no longer, with our eyes open, sustain such gross inequality.
But not everyone agrees with the Act in its current form.
The introduction of the NHI is a monumental shift. The DA has warned against potential devastation the NHI could cause and urges the committee to thoroughly scrutinise preparatory work funded through the NHI indirect grant.
We need free, universal and quality health care for everyone. We need, Minister, the clinics, all clinics in South Africa to open 24 hours, 7 days a week. The National Health Insurance Act, signed into law just before the election, is an insufficient legislative measure.
Parties also again raised the issue of affordability and costs.
One can only regard the budgetary allocations for the Department of Health as extremely optimistic, given that the Treasury estimates inflation with average 4.7% over the next 3 years, meaning the budget shrinks in real terms.
The total allocated budget for 24-25 amounts to 62.2 billion. Some will have a point of view that this will not be enough to eradicate all the problems that has collapsed the public health sector. Chairperson, the biggest challenge in public health care is not a lack of money, but a lack of expertise and sound management.
And a challenge from one of the new kids on the block.
I can assure you, if all of us get our services from the public sector, what we find there will stop. The absent professionals, the ghost professionals that are on ARWAPs and are running their private practices, the attitudes of health professionals towards members, the absence of drugs, absence of services, lack of equipment. If our lives are on the line, we will ensure the public healthcare system works.
After all votes have been debated, the NA will vote on the whole budget and the NCOP thereafter. Zelene Merrington, SABC News, Parliament.